Hello everyone. Today the 17th of November is observed as the National Epilepsy Day. It's also known as the Purple Day. On this occasion, I'd like to take the opportunity to raise some awareness about this very common disorder. In this video, I'll be busting 10 common myths about epilepsy. Let's go into the video. The first myth is that medicines cannot completely control this disorder. The fact is that no, medicines can control epilepsy completely in 2/3 of patients. This has to be done with the right medicine or combination of medicines given in the right dose by your neurologist. The second myth is that patients with epilepsy cannot go for higher education or cannot be placed in high ranking jobs. The fact is that no, there is a huge list of successful people with epilepsy. People with epilepsy can do higher education and can go for the jobs of their choice and can shine in all kinds of professions. The third myth is that if someone has a seizure, something has to be placed in his or her mouth to prevent choking. The fact is that no, doing this will cause more harm than benefit. It will obstruct the patient's airway and block breathing. Hence, if someone has a seizure, one has to place him or her to the left side and wait patiently until the seizure is over. The fourth myth is that you will bite your tongue and swallow your tongue during a fit. The fact is that biting a tongue or tongue injury is very rare, and actually swallowing the tongue during a seizure is not possible. The fifth myth is that you should restrain or hold tightly a patient who's having a seizure. The fact is that no, holding someone down or restraining a patient who's having a seizure will be more harmful because it can cause a bone or muscular injury. The sixth myth is that epilepsy is a psychiatric illness or a mental illness, hence it requires reduction of stress and counseling. The fact is that no, epilepsy is a neurological or a brain disorder and it requires medications. The seventh myth is that a seizure can be stopped by placing an object made of iron or a bunch of keys in the patient's hand. The fact is that no, this does not have any effect. A seizure has to stop on its own, or else it can only be stopped by a spray or an injection administered by a doctor or a nurse. The eighth myth is that a seizure or a fit equals something like jerking, stiffening, sudden fall or loss of consciousness. Anything other than this is not a seizure. The fact is that no, there are some seizures which can have none of these above things. They include sudden staring, blinking of the eyes, drooling or excessive salivation, vomiting, or sudden turn of the eyes and head to one side. All this depends upon from which area of the brain the seizure is originating from. So all this can still be seizures. The ninth myth is that all patients with seizures have a low IQ or are mentally retarded. The fact is that no, most patients with seizures have a normal IQ even with repeated attacks. The 10th and the last myth is that seizures or epilepsy is a lifelong diagnosis and medications have to be taken throughout life. No, the fact is that in most of patients with epilepsy, the medicines can be permanently stopped, but this has to be done at a proper time by your neurologist after running a couple of tests, including an electroencephalogram or the EEG. I think this video must have been beneficial to you. If you know someone with epilepsy or if you are aware of a family who has a child with epilepsy, please forward this video and raise awareness about this common condition among the general public. Thanks for watching.